Ladies and gentlemen, good morning, bonjour, good morgen. Welcome. If you'd like to take your seats. For those of you who weren't at the dinner last night and are joining us this morning, a very, very warm welcome from me. My name is Nick Ross. Like most of you here, I have a personal and professional interest in pain. I suppose most of you do, as physicians, as patients, as carers, as campaigners, as policymakers, as politicians. We have rather outgrown the European Parliament, which is why we're here. In fact, it looks rather sparse, but we are, in fact, almost 200 people here, twice as many as at last year's SIP. And I'm sorry we've had to be moved all around the place from the European Parliament to the Bibliothèque Solvay at last to here. But it's a nice environment and a very warm welcome from me. But the welcome that means something is from the President of EFIC, whose conference this really is. Ladies and gentlemen, Chris Wells.
Thank you very much indeed, Nick. Ladies and gentlemen, I'm, as you've heard, the President of the European Pain Federation, 37 countries throughout Europe with 20,000 healthcare professionals. And I want to welcome you to this wonderful meeting. You've heard already from Nick how things have surpassed our expectations. And this is thanks to certain people, and I want to thank Marian Harkin for hosting the meeting, and the Italian government in particular for putting pain and its management on the map. Because during their presidency of the EU, they called for prioritization of pain therapy and palliative care, culminating in a meeting in Milan in September, hosted by Health Minister Beatrice Lorenzin, in which they made the decision that all of the EU ministers on health, they made the decision that there should be ensuring of training of healthcare professionals in the sector, an exchange of information on effectiveness of therapy for the weakest population group. That's 100 million people throughout Europe. So this is a huge number of people. The societal impact of pain is huge. It's an impact on patients and on society. And that's what we are looking at and have been looking at for 5 years. And this is the 5th symposium. But as you heard, it's by far the biggest. And that's because this wonderful initiative of the Italian government. By helping to ensure that we look at and help ease the burden of pain on these patients and on society, I think we're going to make a huge contribution to Europe. I want to thank you for sharing our passion and for being here, and welcome to the symposium. Thank you.